Welcome to part 3 of our discussion of upper cervical chiropractic care and multiple sclerosis. We just ended by talking about a new theory out there, a mechanical theory coming from a researcher out of Italy, which is trying to be substantiated by a research group in Buffalo, New York, that says that perhaps MS, or at least part of MS symptoms, are related to a mechanical problem, not necessarily an autoimmune response in the body. So there's a mechanical breakdown somehow that's affecting veins and blood flow in the veins, specifically how the body is draining blood from the skull, and that is leading to an incoordination somehow in the nervous system that is contributing to these things that MS people feel. So we left off with this statement. So this chief medical officer at this research group said that this work could overturn the prevailing wisdom that the damage in MS is predominantly the result of abnormal immune responses. Okay, so let's look at what they're going to do as far as changing the altered blood flow. So Dr. Zamboni has created a procedure similar to angioplasty. Angioplasty is where they go into arteries and open them up. Maybe familiar with it is with regard to heart attacks or problems like that. But instead of doing arteries, he's doing veins. He's unlocking veins and changing altered blood flow patterns in the vein system. He claims, according to the article, that this liberation procedure can alleviate many of the symptoms of MS and is due to publish his findings in the Journal of Vascular Surgery. So this is surgery that we're talking about. We're talking about looking at patients with MS using Doppler, finding a change in their venous outflow, and changing that with surgery, and then seeing what happens to their symptoms. That's basically what they're looking at here. Now, how does this relate to upper cervical chiropractic care? For me, this is where it gets really interesting. One of the theories on why upper cervical chiropractic care works is that when we rebalance the head and the neck, changing blood flow in an important area of the nervous system around the brainstem, and that's how things change within the nervous system and why people get the results that they do, sometimes at some very spectacular levels. So what is going on is there's some research from the Upper Cervical Research Foundation. They're combining with a medical research team, I believe out of Chicago, and they're looking at something called magnetic resonance angiography. So you're combining looking at the flow of blood in vessels with MRI. And the initial project, as we scroll on down here, is using phase contrast magnetic resonance imaging for hypertension and headaches. So we're not talking about MS here, we're talking about high blood pressure and the people experiencing headaches. And let's look at the goals of the research. So reading from this research report, we find that it has long been suspected that upper cervical spinal misalignments, imbalances between the head and the neck, result in altered cerebral blood flow. So something similar to what Dr. Zamboni and this research team is looking for, and that correction of the misalignment may produce a, quote, normalization of blood flow and a reversal of related patient-reported conditions. Accuracy and validity for this theory hasn't been there because we just simply haven't had the technology in order to measure blood flow in such a small way. So using phase contrast MRI, they're going to do a pre and post measurement of what is going on. They've already started doing this process of blood flow in the brainstem and the base of the brain before an adjustment and then after adjustment. Changes in cerebral blood flow, going down to that final paragraph, have been demonstrated by medical research to be connected to a number of medically diagnosed conditions and diseases, potentially in this case MS. With the appropriate tools now available, the effect of the NUCA Atlas correction, in this case, procedure on cerebral blood flow may be accurately evaluated. And this is what they've found so far. So now on to these results. A pilot study using phase contrast microangiography with MRI showed actually a lot of change after an upper cervical chiropractic correction. In this case, it was I believe a young woman with intractable headaches. And we have in front of us here pre and post scans. So this is the pre-upper cervical correction, arterial and venous outflow. And this is arterial outflow, and venous outflow afterwards. So let's go ahead and dissect this a little bit. And I want to highlight a key part here. It says in the bottom corner, note in the post-correction graph, so after the adjustment, the venous outflow has decreased. So the amount of blood that is leaving the area, leaving the base of the brain, has decreased. That's what we're seeing here. Before, we have this flow pattern. Afterwards, we have this flow pattern. So the arterial hasn't really changed all that much, but the venous system has changed. So now we come back to our Montel Williams video, and to sum it all up, yes, there may be a mechanical explanation for MS, And there you have it.